For so many of us, staying focused is getting harder and harder by the day, it seems. But our next guest here says we can battle that, and successfully. Dr. Jenny Wilkins, owner of AgeVital, joins us now with ways to stay on track without harmful medications. Now, this is a little slippery slope here because so many doctors say, well, you must be on X, Y, and Z medication. But you try to approach conditions like ADHD, let's say.
Correct.
In a more natural way.
Right.
How do you do that?
I have a slogan that I say, biology before pharmacology. So my whole entire facility is a pharmacy, research, and wellness. So I provide doctors with research papers and studies to, back up biochemistry of the body. And then going back to the biochemistry of the body. That's why we eat foods, right? We eat because we're deriving all of these chemicals from our foods. And so then we take those foods, the micronutrients and macronutrients, and we make supplements.
So let's talk about ADHD and ADD specifically.
Yep.
What are they? And we hear so many kids who are on it, but it's really more widespread than that, isn't it?
Yeah, you have adults, you have the elderly, because ADHD is just so much more than just attention deficit disorder. It's more of a cognitive, you're getting forgetful, you can't focus, or you're hyper-focused on one thing, and it can cause a lot of other side effects too, like panic attacks, anxiety, because I have some children, I work with a company called Neuroscience, that they'll send us these children and they're focused on so many different things, too many conversations at once, and then they can't complete a task in front of them. So we have to find out when we do this, through clinical studies. So it's all evidence-based. Functional medicine is what it's called. You have mainstream medicine, which is allopathic, and then you have functional medicine, which is more biochemical. So you're looking at real analytical nutritional markers, hormonal markers, and that's what I have here. I have chewable vitamin C, which is very important to help you focus, and with ADHD, a lot of children come back deficient in vitamin C, and adults too, and so vitamin C is very important for a lot of other things as well.
Sure.
And
you talk about a lot of amino acids.
Amino acids, that's
so why
probably
are we so
the big one.
Yeah, why are we so deficient in amino acids?
Well, amino acids are the building blocks to everything, but things are genetically modified. Our foods are genetically modified. You have animals that are hormonally tampered with, and so they don't have the right amino acid strain in there. And then you have, when you're eating your foods, people aren't digesting it. They're not breaking it down and pulling those amino acids from the foods because they have a lack of microbiome in their gut. So a lack of probiotics, which is the good gut flora and digestive enzymes. So your body's like a car. You have to treat it very much like a car. Or another analogy I like to use is a metabolic orchestra. If you have your violinist over here out of key, the whole entire symphony is going to sound really bad.
Absolutely.
Yeah.
Okay, so say a parent brings a child with ADD or ADHD, or an adult comes in with the same condition. How do you treat them?
First, we would assess them. We would do, like a cognitive panel to look at amino acids, to look at vitamins, minerals, probiotics, look at all of the trace elements in the system. And once that panel comes back, then we'll say, okay, this is what your child's deficient in. Let's go ahead and get to the root cause of the problem, as opposed to going to America's Band-Aids, right? And there's a lot of Band-Aids for a lot of boo-boos.
The pharmacology.
Yeah, the pharmacology, right. And I have a pharmacy too, so I do both, know? But I love to get people off of those Band-Aids for boo-boos, as opposed to just saying, here's the blue pill, the purple pill, the yellow pill, that pill.
And it's all
good
natural.
luck, right. It's, okay, let's get back to the root of the problem. Why can't you focus? Why are you hyper, stimulate?
Right, stimulated, exactly. All right, well, doing it the natural way. Okay, Dr. Jenny, thank you so much. And if you want to find out how to do this, all you have to do is call 888-388-7237, or you can head to Dr. Jenny's website, AgeVital.com. Thanks so much, Doctor. Appreciate it.
Thank you.
All right, and we'll be right back with more Daytime right after this.